Okay, well, thanks for the introduction, Erica. So, my name is Jessica Douglas. I go by Jess, and I've been with Providence for 6 years. I'm part of the Providence Community Wellness, and I'm a registered dietitian nutritionist. I got my master's at University of Idaho. I've been an outpatient dietitian for 3 years, and I work with patients one-on-one to help with weight loss and weight gain, GI issues, help work around allergies and intolerances, working on like well-balanced diets, working with patients with prediabetes, working with patients with diabetes. Um, and also, I've worked with many patients that have PCOS as well. And I'm just happy to be here and share with you what I know. And again, if you have questions, just go ahead and type them in the chat, and we'll get to those at the end. So, kind of what's going to happen with this session is going to give you an overview of PCOS, what it is, who it affects. We'll review diets to help with PCOS, and yeah, there's more than one. And then we can go over like food and nutrient specifics, go over like some supplements of interest, and then specifically like the dietitian's role in all of this, and then ways to make small sustained changes over time. So what is PCOS? It's polycystic ovary syndrome. It's a condition where cysts, so small sacs of fluid, develop in the ovaries. PCOS can cause irregular menstruation, so irregular periods, and it's a common cause of infertility. In addition to infertility, it's a lifelong condition that can have other impacts. So, can cause weight gain, especially at the waist. It can cause acne, um, excessive hair on the face and body, thinning hair on the scalp. It can cause skin tags, darkening of certain areas of the skin. It's been linked with depression and anxiety and poor sleep quality as well. And obesity and infertility have been observed in 70 to 80% of people with PCOS. And so it also is associated with insulin resistance. So that increases risk of developing type 2 diabetes. More than half of women with PCOS will develop type 2 diabetes by the age of 40. This also increases your risk of gestational diabetes, increased risk for heart disease, hypertension, high LDL cholesterol, lower HDL cholesterol. It increases risk for stroke and sleep apnea. And then having PCOS might also increase risk for certain pregnancy complications as well. So again, the gestational diabetes, possible increased risk of preeclampsia, high blood pressure, increased risk of preterm birth as well. And, a lot of us may know somebody with PCOS. I have, friends, family members with PCOS. So it impacts, I say, most of us. So, and who does it impact and how many people? So people of reproductive age with ovaries, so 8 to 13% of women worldwide in the reproductive years have PCOS. And a lot of the times it is undiagnosed. And in the US, 5 to 6 million women have PCOS. It's the most common hormonal disorder among women of reproductive age. And, many women don't know they have it because sometimes it doesn't present with outward symptoms. So, risk factors causes the cause of PCOS is unknown, but possibilities include like there's a genetic component, possible hypothalamic or pituitary disorders, ovarian or adrenal disorders, hyperinsulinemia, due to insulin resistance. And there is, again, that strong association between obesity, insulin resistance, and that genetic component. So those go together. And then how it's diagnosed is going to be two of the three. So either having signs or symptoms of high androgens, so unwanted facial or body hair, loss of hair from the head, having acne or elevated blood level testosterone, so increased androgens. And this is after other causes have been excluded. So like pituitary conditions, other hormonal conditions have been excluded. So that's one potential criteria for diagnosis. Another is having irregular or absent menstrual periods after other causes have been excluded. And then an ultrasound finding polycystic ovaries. So two of those would meet criteria for diagnosis. And then what is the treatment? So we'll go over specifically like lifestyle interventions. Usually that's the first line is lifestyle interventions. Birth control is a medicine if the patient's not planning to become pregnant. Progesterone, also metformin may be used for insulin resistance. But we're definitely going to talk about the lifestyle interventions for this as well. And I mean, we can go over a little bit of, there's also surgery can also be an option for restoring ovulation, but that is usually not like the first line there. And also in vitro fertilization for people with PCOS wanting to become pregnant is also an option. So let's look at lifestyle interventions. All right. So you've heard it, diet and exercise, and we'll focus mainly on diet for this presentation, but stress management is also important, improving sleep. But mainly we're wanting to promote weight loss, reduce insulin resistance, balance that lipid profile, reduce inflammation, and address micronutrient deficiencies. So diet can absolutely promote weight loss. So reducing foods higher in saturated fat, higher in salt, higher in those added sugars and those simple carbohydrates that are very easy to digest. And we want to increase the variety of foods, increase the nutrient density of foods. So getting foods that are higher in fiber and complex carbs, vitamins, minerals, phytochemicals, rich in antioxidants to help reduce inflammation and help address any micronutrient deficiencies, like a deficiency in like vitamin D or zinc. And then we want to help balance those lipids, so improve cholesterol. And we're going to look at several different diets that can help us do this. And then exercise, like I absolutely want to touch base about this. So it's so important to include exercise in these interventions because this is like going to promote, it can help promote weight loss. It is also going to help improve insulin sensitivity as well. And even a minimum like aerobic activity of 120 minutes a week or a little bit more can show results. And so it's pretty much just however, you want to get moving, like how, like you have to meet people where they're at when, recommending like any exercises, because everybody's going to be on a different level and have different medical needs for that. Or just be in like different stages in their life as well. And so with weight loss, diet-induced weight loss of just 5% contributed to reducing levels of insulin and androgens, restoring ovulation, and increasing fertility rates. So that 5% there for weight loss, and that's not a whole lot. That's 5% of total body weight. That is not a lot of weight loss to see all of these great results to help reduce the symptoms of PCOS. And reducing inflammation. So by increasing antioxidants, by increasing the variety of foods in the diet, basically increasing colorful fruits and veggies to help reduce inflammation. And so there's different pro-inflammatory factors that fat tissue can produce that contributes to the development of inflammation in PCOS and can increase free radicals. And so antioxidants help reduce the amount of free radicals and reduce chronic inflammation. So we're going to look at ways to do that through diet. And then it's also of note, for stress management. I mean, I am a dietitian, so as far as stress management, just making sure the patient feels like, is managing their stress okay, that they have resources available, that, they're seeing a counselor or have good family support, friend support, they're doing things for themselves, and, making sure that like they have a plan to reduce stress in their lives. And sometimes stress can be unavoidable. Like life events happen to everyone, and we all deal with stress in different ways. But since PCOS can also be associated with depression and anxiety, it's not necessarily the causation, but there's kind of a little bit of an association there. It's just important to make sure that the person with PCOS has that support in place to help manage stress. And then sleep apnea has also been associated with PCOS. We'll talk a little bit about sleep. It's important to check that the person with PCOS is getting enough sleep. And sometimes that is really hard to do, but encourage them to reach out to their primary care provider for ways to help improve sleep, and to make sure that they're also using that they're on CPAP if it's needed and recommended by their doctor. And poor sleep quality is associated with increased risk of obesity and insulin resistance, which plays a key role in PCOS. So just, check in like, how much sleep are you getting? Are there like simple ways to get a little bit more sleep? Can always make a little bit of suggestions like that. Or if they're needing more support, asking if they've talked to their doctor about ways to help get better sleep. All right. So now we are going on to more nutrition terms. So before like I really dive in here and get super granular with like nutrition, because I'm a nutrition nerd, like I love food, and all of the little bits and pieces it's made of. So we need to understand a few basic terms. So if you've all heard about like macros, got to get your macros. So food is made up of macronutrients. These are the main nutrients that provide calories, the source of energy that our body needs to keep working. They provide energy, it's fuel for the gas tank. So these macros here, carbs, carbohydrates. So that first one there, and these have gotten a bad rap. I feel like when some people come into my office, they're always talking about, how bad carbs are, like they cause, weight gain, all of this, but really they're an important part of food. They provide energy that our muscles and brain needs to like keep going. And so that's going to be things like fruits, like whole grains, and those Starchy veggies, things like beans, peas, and lentils are going to have carbohydrates. And fiber is also a type of carb, doesn't have a lot of uh, energy associated with it. We can't break it down very well. And so that's kind of fiber feeds our gut bacteria, and it also keeps us fuller longer. It helps move everything through, can help prevent constipation. And then protein is going to be found in dairy products, your meat, um, again, nuts, beans, and seeds, going to be a good source of protein. So animal sources, plant sources of protein. Protein helps repair your body's tissues. And fun fact, it contains just as many calories per gram as a carbohydrate. And then with fats, another macronutrient, they are made up of, so you're going to find fat in dairy products, meat products, uh, nuts and seeds, oils, and they help us absorb micronutrients, fat soluble vitamins. And they help us make hormones, they help with satiety, and they provide a bit more calories per gram. So they're a little bit more calorically dense, but still an important part of the diet. And then micronutrients, they don't provide energy, but they're needed in smaller amounts in the body for biological enzymatic processes to take place. So we don't want deficiencies in any of these. And so you're going to find like water-soluble vitamins, fat-soluble vitamins, so vitamins C and B are water-soluble. They're going to be found in like citrus fruits like peppers, like whole grains, eggs, and then fat-soluble vitamins A, D, E, and K can be found in certain fruits and veggies and eggs and dairy and just all kinds of foods. So it's like so foods are very complicated and they're a whole package. They're not just going to be like a single like macronutrient or like a single vitamin. They're complex. They're going to come packaged with all of these in them. Maybe not like complete package with every single one of them, but bits and pieces here and there. So that's why it's important to eat a varied diet. And then things that necessarily aren't noted on here are antioxidants. And antioxidants are certain micronutrients such as vitamin C and E, as well as phytochemicals, so carotenoids and polyphenols, and they're going to be in like many different foods, and they're going to basically reduce free radicals that cause damage to our cells over time. So those free radicals, those little electrons, they're going to grab them to prevent damage to our cells. And so, those common antioxidants are going to be vitamins C, vitamins E, and then different phytochemicals, and we'll talk a little bit about those later. But just so you know, it's like to just eat for like we just want to eat a variety that will include basically all of these parts, and break, all of these different little itsy bitsy pieces here. So different micronutrients and macronutrients. And so we will move on. So diets defined. We're going to look at more than these three diets, but we're going to kind of explore, like, because as long as we are promoting weight loss, this is going to be beneficial. So for the keto diet, it is going to be very high fat. I'm bringing back the diet pyramid here. So very high fat, moderate in protein, and very low in carbs. And it promotes the body to make and utilize ketones as an energy source. So it's a little bit of a different way to eat. It does promote weight loss. And the DASH diet is rich in veggies and fruits and whole grain. It's low-fat dairy, lean proteins. Kind of think my plate here. Low in saturated fat, lower in refined grains, lower in sweets. And then there's the Mediterranean diet, high in a variety of veggies, fruits, whole grains, nuts, seeds, beans, as well as a bit of seafood, lower in meat. There's still some meat, and olive oil is the main source of fat. And there are about three other diets that aren't shown here. So there's the low glycemic index diet, which is kind of think lower carb diet. It's sometimes maybe confused with keto. It's going to be choosing like more complex carbs. So carbs that come with fiber, think like whole grains, think quinoa, things like that, less like white rice, white bread. And so carbs make up about 30 to 50% of the diet, and then fats roughly 30%, protein about 20%. And then in the research, the pulse-based diet was also looked at, and that's just adding in about a cup of beans a day, beans, peas, lentils, and then bariatric surgery was also listed in the research for promoting weight loss. So we'll also look at that as well. So in the research, the Mediterranean diet helped promote weight loss. It improved inflammation markers. It improved insulin resistance. It reduced androgen production and improved ovarian form. And when looking at the keto diet, it promoted rapid weight loss, improved lipid profiles, so increased the HDL, decreased the LDL. It increased the amount of antioxidants in the diet and decreased androgens as well. And so with the DASH diet, again, weight loss was seen. It improved insulin resistance, improved lipid profiles, decreased androgens, and increased antioxidants. And with the low glycemic, again, weight loss. It reduced leptin, it decreased inflammation, improved fertility, and the pulse-based diet improved insulin sensitivity, and then bariatric surgery, you found rapid weight loss. So in all of these except the pulse-based diet, we're seeing weight loss, we're seeing improved insulin sensitivity, we're seeing reduced androgens in some of these, and then improvements in the menstrual cycle. So these diets, largely, if they're promoting weight loss, we're going to see positive impacts for people with PCOS. We're going to see a reduction in symptoms if we're seeing that weight loss. So then let's look at some of the cons here with a few of them. So with the Mediterranean diet, it's going to be a longer time to lose weight. And not everybody can, get all of that variety in all of the time. With the keto diet, what I found was good short-term results for weight loss, but managing this diet long-term was very difficult because it can be very restrictive. It can increase the risk of non-alcoholic fatty liver disease, especially if you're getting a lot of the fats from animal-based sources. But there was some promising results with kind of a modified keto diet, where the fats were coming mainly from olive oil. So that improved outcomes a little bit, but it is again very restrictive and hard to stay on long term. And then with DASH, um, again, a longer time to lose weight as well. Same thing with the low glycemic index diet, longer time to lose weight. It's a little bit restrictive, a bit lower in carbs, but less restrictive than the keto diet. The pulse-based diet didn't lead to weight loss. It was adding beans in, but simpler to follow. And then with bariatric surgery, that, meeting all the requirements for surgery, going through the process, going through actual GI surgery, and then having to alter eating habits significantly due to change in GI anatomy. Stomach's getting smaller, so small frequent meals and snacks, liquids between meals. It is a big change. And so, what is recommended for PCOS? It's going to be, I mean, that doesn't mean that, other diets couldn't work for PCOS. It's just with the Mediterranean diet, it's been included in international guidelines among like recommended healthy dietary patterns, because it's including regular consumption for unsaturated fats, fiber. It includes low glycemic index carbohydrates, includes lots of antioxidants and vitamins, and appropriate amounts of animal-derived protein. So smaller amounts of protein, and then there's been many studies over decades that have shown that the Mediterranean diet pattern can protect against insulin-related diseases, insulin resistance-related diseases such as obesity, cardiovascular disease, type 2 diabetes, non-alcoholic fatty liver disease, cognitive impairment, breast cancer. And so the beneficial mechanisms of the Mediterranean diet involve reducing inflammatory and oxidative stress markers, improving lipid profiles, so cholesterol, improving insulin sensitivity, and it's also regarded as the primary prevention of metabolic syndrome. So taking all this into consideration, like especially the relationship between PCOS and obesity and the low grade chronic inflammation and insulin resistance, it is seems to be best suited, one of the more optimal diet strategies to help reduce symptoms of PCOS. So that's why the Mediterranean diet. But that doesn't mean that other diets won't also give results. And so, what is the Mediterranean diet? It's I got this diet pyramid here. So we're going to be, looking at kind of the base of the pyramid is more, it includes physical activity, like having meals with like loved ones or, in groups, like getting like moving in a joyful way. So it still is including that physical activity, just as a reminder that base of the pyramid, fruits and veggies, colorful fruits and veggies, kind of eating the rainbow of fruits and veggies throughout the week. Don't need to be doing that daily. That can get really expensive unless like you're making, a type of like rainbow cabbage salad, things like that. And then this is also the base is including complex carbs, and it's going to include, nuts, beans, seeds, pulses. And then a little bit above that, like getting different sources of protein. So seafood just once or twice a week. And then above that, like a little bit of dairy, some lean meats. So things like poultry, low-fat dairy, things like low-fat Greek yogurt. And then at the very top, enjoying like those fatty meats in moderation, meat as more of like a topping, sweets as, a some of the time food. And on the side here, water as the main liquid. And then I also want to talk about wine because I feel like every time that the Mediterranean diet comes up, it's like, oh, I can have red wine and in moderation. But I mean, what does that mean? So, and why red wine? So I want to talk about that because red wine contains an antioxidant called resveratrol, and it is, again, going to help reduce free radicals, reduce inflammation. But I mean, red wine is also coming with liquid calories. It contains ethanol. So there's other ways to get resveratrol in the diet. So things like berries, things like grapes, which is what the wine is made of. So you can have berries, you can have grapes, and also peanuts can have a little bit of it. So you don't have to start drinking wine and you don't have to be like, ah. So just getting a variety of berries or adding some grapes into your diet, you're still going to get the benefits of that. So you don't need to add those liquid calories in. And then what does it mean when it says like moderation? So like a glass of red wine, 5 ounces. And so every wine glass is different sizes. Um, so, measuring out like what a 5 ounce amount and what that looks like and getting familiar with that. And it's like 1 5 ounce or like one serving of alcohol a day is considered moderation for women, and 2 servings a day is considered moderation for men. But again, like you can get it from berries and grapes. And so looking at this plate method here, this is just to kind of break it down a little bit further. And not every plate's going to look like this, but making more of your plate those, half that plate fruits and veggies. Um, about a third of that plate whole grains, and then another third of that plate, like roughly like a sixth of that plate, like nuts or seeds, or like a small serving of fish or poultry, or a little bit of red meat or beans or peas, and then that fat of choice being olive oil. And a little bit of low fat or non-fat dairy on the side, and water as the main drink of choice. So that's kind of the Mediterranean diet broken down. And just to kind of bring it home, foods to have a little bit less of the time that are kind of at the top of the pyramid there. Things like saturated fats, so those fried foods, those pastries, those really delicious fatty meats, a little bit less butter. Things like added sugars. So if you're having your sweet treat, you know, have it just every so often, just a few times a week, and make sure it counts. Make sure you're there with it. Make sure you enjoy it. Um, can be helpful. So things like, and that includes sugary drinks. So reducing the amount of like sugary drinks can help reduce the total amount of sugars. Reducing simple carbohydrates, that's not to me, that's not, you know, these aren't necessarily bad or evil foods. These are just foods to have a little bit less of the time if your diet's a little bit out of balance. So, choosing brown rice over white rice more of the time, choosing whole grain bread over white bread, whole wheat pasta over regular pasta. And then just reducing like very highly processed foods overall, like, lunch meats that are really high in salt, those dressings, blue cheese dressing that's like really high in fat, but that doesn't mean to say you have to like necessarily give them up. It's just taking a look at where you're at and finding ways to reduce these a little bit over time. To eat in more of a Mediterranean style way. And then foods to have more of the time. I feel like I've said this a few times, but colorful fruits and veggies. Eat the rainbow throughout the week. More beans, peas, and lentils. Well, I think like Pullman's the lentil capital of the world, so maybe go to a like lentil fest to get inspired, like inspired lentil recipes. More whole grains, complex starches. So, those starchy veggies. I said quinoa before, but you can really explore like ancient whole grains. Just, if you're exploring them, buy a little bit in bulk, um, and then kind of look at ways to cook them that is more palatable, but they take a little bit of doing. Increasing olive oil, nuts and seeds, and eating a variety of nuts and seeds. I've been asked, it's like, which are the best? It's kind of just up to what you like. Walnuts are a good source of ALA, which converts to omega-3 fatty acids, but like pumpkin seeds are high in magnesium. So basically variety. So there's not just like one food or like one herb or like one specific type of thing you should like have all the time in exclusion to everything else. It's really about getting a lot of different things. So you're getting a well-balanced diet. So you're getting all of your nutrients, all of your vitamins, all of these, trying to get the most uh, antioxidants that you can by eating a variety. And, this diet can always be modified. So, if something's not, going to work for you, like say, not a fan of seafood, that's okay. Just getting like more heart healthy fats from nuts and seeds can be just fine. Um, can always like consider different supplements as well. So there's different ways to get to near this diet. You don't have to strive for perfection. Even making a few changes is better than doing nothing. And so these are just some pictures of some foods that I found around my mom's garden. So the raspberry, and this was just a few days ago, so the raspberries are still kicking. So resveratrol right there with some raspberries. There's some mint, so some green mint. That's like a delicious thing to have with a little bit of like kind of like a mint melon salad is really good. Or looking at the blueberries there. So they have a lot of anthocyanins, which again, that's, an antioxidant. And this guy here on the far right is purslane, which is a plant-based source of omega-3 fatty acids. So definitely look up purslane because that is a neat, like most people consider it like a weed, but it's actually eaten in some countries around the Mediterranean. And it's tasty. It's kind of got a little bit of a citrusy note if you pick it in the morning, but always make sure that it's identified correctly. So don't just go out there and be like, oh, this looks like purslane. Just, yeah, do a bit more digging, do a bit more research on that, or find your friend that is very good with plants and can identify it and make sure it's correctly identified before eating it, and that it's harvested from a, a good spot, not by a roadside or anything like that. And there are other plant lookalikes for that one too. So just make sure you're 100% certain before having that one. So, supplements of note. The research showed that a vast majority of women with PCOS consume an improperly balanced diet. So, we're seeing deficiencies in fiber, omega-3 fatty acids, calcium, magnesium, zinc, folic acid, vitamin C, vitamin D, and vitamin B12. So, that's a lot. So, we want to address any of those deficiencies, but looking at ways to get some of these nutrients through food first. So we definitely like vitamin C is an easy one. Like that is found in a lot of citrus fruits, strawberries, peppers are a great source of vitamin C, magnesium, like pumpkin seeds, nuts and seeds with zinc. But sometimes supplementation may be necessary. Just, touch base touch base with the primary care provider and ask what their thoughts are with like supplementation for the patient. And so with like specific ones of note was vitamin D levels in PCOS patients. So they were a little bit lower, so they were just found to be a bit lower, but vitamin D supplementation, let's see here, enhances insulin resistance and sorry, it reduces insulin resistance and lipid metabolism and, oh, excuse me, I just, 2 seconds. My notes. Increases insulin synthesis and release and increases insulin receptor expression and increases insulin response to glucose transport. So, I mean, plus a lot of people up here are deficient in vitamin D anyways, just the lack of sunlight. So, touching base and making sure that, if they are on a vitamin D supplement, that they're taking it as prescribed. And zinc is also found, so kind of moving on to zinc, it's also found in like oysters and chickpeas and lentils, nuts and seeds. And so the reason, we're doing, making sure having enough zinc is zinc plays a role in lipid and glucose metabolism as well as fertility. And, just making sure that the patient's getting adequate sources of calcium. So from either dairy or fortified dairy alternatives. You can even find calcium in like canned fish, like if the bones are softened, that is a source of calcium as well. Folate and folic acid, leafy greens, eggs, legumes, fortified cereals. And then some supplements of note. As far as CoQ10 was found to have a beneficial effect on inflammatory and endothelial dysfunction markers in overweight and obese patients. So it might be something to consider for patients with PCOS. And inositol is a form of sugar in your body that your body naturally produces it to provide structure to your cells. It can also be found in certain foods like meat, fruits, corn, beans, grains, and legumes. I feel like I've said legumes about 400 times. So, but the typical American diet only contains about 1 gram of inositol. Research suggests that taking this supplement may have health benefits. And so, in addition, let's see. It can improve some of the symptoms of PCOS, possibly lowering blood sugar, possibly reducing a little bit of triglyceride levels, has been shown to promote ovulation. But absolutely talk to your healthcare provider about any of these supplements. And then omega-3 fatty acid, it's found in fatty fish. So salmon is a big one. It can be found in some shellfish. There are plant-based sources of omega-3 fatty acids like flaxseed, walnuts, and that's ALA that's then converted to omega-3 fatty acids. And at higher doses, they can lower triglycerides and may help ease inflammation. But, taking omega-3 fatty acids, it can act as a blood thinner and can interfere with certain medications. So with these supplements, always reach out to your primary care provider before considering these. And again, like, can get some of these through food first. So these guys here, vitamin D, zinc, magnesium, calcium, folic acid, vitamin C, the omega-3 fatty acid, we can get, and inositol we can get through uh, foods first as well. And then some herbs and spices of note. These are in addition to, diet and exercise. And I haven't included some of the herbs that I read in the research just because they can be potentially harmful in larger amounts, like licorice. And more studies are needed on these herbs as well. There's just been a few. But so for turmeric, um, curcumin is the biologically active phytochemical in it, and it is a reducer of oxidative stress-related complications with patients with PCOS. Green mint is another one of interest, as well as um, marjoram, and it's been shown to have a possible anti-androgenic effect. And as far as green tea goes, and same thing with green mint and chamomile, possible antioxidant effects. So could possibly reduce inflammation. But again, it's like, and these are generally like regarded as like safe, and they're delicious. So thinking about like ways to season foods with some of these, like they don't have to be taken in a supplement to be effective. Like marjoram, I mean, that is a Mediterranean herb. Like, it's going to go great on a lot of things. Green tea is delicious. It has a tiny bit of caffeine. Green mint goes with a lot of things. Like, cinnamon is going to be great on oatmeal, on fruit. And these can always be had as a tea as well. And don't get me started on curry. Like, that is just delicious. So, kind of where do I, my role as the dietitian, um, just small steps lead to big changes. I need to meet people where they're at, and, are even some or just one or two of the features of the Mediterranean diet attainable for each person? Because everybody is going to come with their own story, their own lists of likes and dislikes, their own, financial constraints. So you can't just like recommend the same thing for everyone because it's not going to fit. So meet people where they're at. It's like, how can we increase a little bit of physical activity? Like, are there any like veggies that you do like that you could get more of, or ways to get in more fruits? Or what do you think about adding a little bit more beans in your diet? Or, is there like a different dessert you could have, versus like ice cream? So meet people where they're at. Look at kind of small ways that, you can change your diet. So, and then the key takeaways from this, because we're starting to run low on time, just wanting to help promote weight loss. So that 5% weight loss, you're going to see results. You're going to see reduction in symptoms of PCOS. And then choosing a diet that is sustainable long term, meeting people where they're at, what small changes can be made in your diet, like right now, even if that's adding in like bell peppers, just something quick and easy that you weren't doing before. Address micronutrient deficiencies. So, like looking at someone's diet history, like, are they getting in enough calcium? Are they getting seafood twice a week? Are they getting, enough vitamin D, enough zinc? um, and then help promote physical activity, get people moving, and then like what's going to be sustainable for physical activity for them, whether that's just a 10-minute walk. That's better than a no-minute walk. It's just those little changes that really do add up over time. And then herbs and supplements in addition to diet, exercise, and medical interventions. These aren't just like taking turmeric is not going to solve all your problems. You got to do other things in addition to that, and these might help and support that as well. So that is what I've got. How are we doing?
Yep, I've got lots of questions here for you. I'm going to try and do them in the order that they came in. Someone earlier had a question about specifically calorie deficit diets. Can a calorie deficit be beneficial to people with PCOS?
Absolutely. So a calorie deficit is going to promote weight loss. So calories in, calories out. And so it's just how you do that. You can count calories, you can watch portions, or like look at your diet where it's at and see if there's ways you can either reduce portions or like say reduce added sugars or like even like taking out a sauce. So absolutely creating a calorie deficit will promote weight loss and will help someone with PCOS.
You also talked a lot about some different diets that exist out there and different ones that you recommended. There is, a history for some people that try a diet, maybe it does or doesn't work, which can kind of fluctuate their weight back and forth. How does that affect their PCOS symptoms? Does it make it worse long term?
So with like yo-yo dieting and crash dieting, if a diet is not sustainable, if a diet is extremely restrictive, and then I wouldn't necessarily recommend a very restrictive diet or a diet that's not going to work long term. I would more go with like small sustained changes that are going to lead to slow, steady weight loss. So with crash dieting, like say like an extreme calorie deficit of like, being on, I don't know, 700, 800 calories a day. Yes, you're going to see weight loss on that. You could also see micronutrient deficiencies with that because you're not getting in enough of those needed foods to sustain yourself. So you could see rapid weight loss, but like at the end of the day, are you going to be able to maintain that? And is it necessarily good for your long-term health? So with those extremely restrictive diets, that can be very harmful to somebody with PCOS or just for like anybody with PCOS or without.
Then more specific to PCOS, you had talked about different ways that we can get a diagnosis. Is there a diagnostic test for PCOS other than symptom assessment?
So, I mean, they're looking like, so what I reviewed is like you have to have or two out of the three things. So either like like they can do a blood test for increased androgens. But that's not the only criteria if you're having, yeah, those symptoms as well. So you kind of have to check two of the three boxes. And no, there's not just like a specific test. It's like yes or no for PCOS. It's an assessment, and sometimes it can take years and sometimes it's missed, and that's very frustrating.
How about intermittent fasting? Is that beneficial for people living with PCOS?
Wow, that's a great question. So for intermittent fasting, if it is not extremely restrictive, again, like there are some like intermittent fasting uh, can promote weight loss, but it can promote weight loss for some people and not others. So, say if you're somebody that's more prone to like snacking at night, and that might be a way to reduce snacking at night by like, hey, I'm gonna stop eating at like 7 p.m. after dinner. That can cause a calorie deficit, that can cause weight loss. But say if you are restricting so much that it's like you're eating all of your food within a 4 hour window, I mean, that can add to some like not so great impacts like possible like overeating or not getting in enough nutrients. So with intermittent fasting, it's kind of like a case by case basis, and as always, like if you're creating those food rules, that can increase like possible disordered eating like patterns, so you have to be very careful with it, and always give yourself like grace. So when like, and it's probably not great to be creating those food rules, but say if it's just like, oh, I'm gonna stop eating after this time or not have a snack after dinner, that's reasonable. Or, like a 10-hour eating window is more reasonable versus like a 3 or a 4 hour eating window. Does that make sense? It's kind of a, in
Uh,
certain circumstances, maybe.
you gave a lot of good food recommendations. Someone is asking here in the Q&A, can you explain what kefir is?
Yeah. So that's a fermented liquid dairy product. And I actually haven't had it myself, but it's like those more like it's got some probiotics in it. It's fermented for a little bit longer than yogurt, and it's very tangy. And sometimes, like with kefir and like some yogurts, sometimes they'll have added sugar in them. So just read the nutrition facts label and make sure it doesn't have like a bunch of added sugar. And I'm talking like, over 10 grams per serving. That's because typically they'll add a little bit more sugar because it's kind of got that really tangy flavor.
I've got two last questions for you, and I'm hoping we can get to them both. Someone here in the chat does have PCOS and has noticed that avoiding dairy seems to consistently make a big difference in the severity of their symptoms. Is that a common finding that you have found or something that you've noticed that affects those symptoms?
Well, so with dairy, I haven't read anything that specifically avoiding dairy with PCOS was seen to be beneficial, but again, every person's going to be a little bit different. So, like say with lactose intolerance, if somebody has that and also PCOS, like they could be having some symptoms of lactose intolerance, like gas and bloating, where they're or things like diarrhea, where dairy is not working for them as well. And there are other, like you can, have a Mediterranean style diet without doing dairy, like just as long as you're getting calcium, like either from, a calcium supplement, like asking your doctor about that, or from other like dairy-free fortified calcium sources. So again, like those like things like oat milk or soy milk, again, like low sugar and stuff.
Then the last question that I have here for you, and I'm hoping I'm not missing any others. For people that have a history of disordered eating, how would you recommend starting to make some of these changes that you talked about?
Yeah, that is a great question. So I would say just again, meeting someone where they're at. I would work with adding more foods in. I would definitely work with adding more foods in as like tolerated. So if, they're eating is a little bit, not having as much variety, then seeing like what foods they could explore and enjoy that are going to make, their whole nutrition profile a little bit more varied. So working on, adding like some more colorful fruits and veggies, exploring some whole grains, like what are, like and exploring like the produce section of the grocery store can be beneficial, or exploring like farmers markets to get kind of excited about it. So kind of starting from a positive, rather than talking about like reducing. Does that make sense?
Thank you. That's all the questions that I'm seeing here. So thanks so much, Jess, for being here. And thank you all for participating and spending your lunch hour with us. If you have any questions or things that I missed or things that you want Jess to answer, feel free to shoot us an email. I just put it in the chat there, that wellness.w@providence.org. And we will send out an email with the YouTube video to watch this on your own time as well. So thank you so much. And we hope to see you next month. Next month, we're talking about finding accurate health information online. It should be a good session. So hope to see you all next month, and feel free to reach out if you have any questions. Thanks.
Thank you all for your time.